and you got to have a wander around some of the exhibitor stands and chat to some of our sponsors and partners who are here today. I'm really pleased to get this next session going. And first up, we've got Dr. Mustafa Ghafouri, who is a director at Dr. Data Limited. I was chatting to him in the break, so I'm already quite excited to hear what he's going to tell us about this morning. And I was also former principal data scientist at NHS Digital. He's going to be talking to us about harnessing data to build up better data ecosystems and levelling up early cancer diagnosis. So thank you, Mustafa.
Hello, and thank you very much for joining us this morning. So first I'd like to just tell you a bit about myself, because I have a slightly unusual background. I am a medical doctor, but 8 years ago I transitioned and became a data scientist. During this time I've worked in multiple different NHS organisations, including NHS Digital, where I worked as a principal data scientist. During this time I've worked across a range of different healthcare data environments, from big national data sets to regional NHS bodies to smaller NHS trusts. And I'd like to share with you some of the lessons I've learned during that time. So most of you here should know that data and digital play a very pivotal role in the NHS long-term plan. Actually, data and digital solutions are at the heart of solving some of the NHS's biggest problems. A good example is demand and capacity, or solving the wait list problem, the backlog, or even improving the quality of care for patients. However, despite this huge promise, I think it's really important that we ask a very important question, which is, do these data projects work? Now, having worked with several data projects, I can tell you firsthand that data projects are very, very difficult. Worse than that though, data projects are often underestimated and are not appreciated for the complexity in which they are. Those that might recognize the logo at the bottom left will know that that is the National Project for IT, a project that was estimated to have cost 10 to 12 billion. That project has been completely shut down now and added very little value. It is an honest assessment to say, how do we make sure we're successful in our data projects going forward? How do we skip the hype and get down to reality in making sure that we are part of the 15% of data projects that are successful? Now, it is often said that data is the oil of the 21st century. And this is completely true. Data has a lot of value, particularly in modern times, to produce great insights that can add great value to patients and the NHS. In particular, the NHS is sitting essentially on a treasure trove of value and data. Now that is well understood, and I'm sure no one here is surprised by that. However, where I think we do have problems is understanding how to get value out of that data. Now, data, like oil, is often provided in its raw format. Also like oil, however, you need to refine the data in order to make sure you get the value out of it, otherwise it's useless. What do I mean by that? As you can see, you get raw crude oil and it goes through a transformation process to make the valuable oil products, such as engine fuel. Similarly, in data, you need to go through the right transformation process to create data products and get value out of your data. What I'm saying here, in summary, is that you need to invest in your data correctly to get value out of it. Now today we're going to talk about 3 areas in which you can invest in your data to help you get value out of your data. The first is investing in understanding and integrating your data. The second is investing in all your data, identifying the blind spots and ensuring you manage them adequately. And the third is ensuring that you invest in the people who are going to bring value to your data. Because without them, what is the point? So we'll deal with these one by one. Right, if we deal with the first one, understanding your data. As a data specialist, I often get told how to do my job by people who haven't really experienced data, have never coded, or have never dealt with data themselves. Sometimes working in healthcare data does feel like a bit of a buzzword lottery, and that's not to attack anyone, but often you'll hear people throwing words around such as interoperability, AI, or even HL7 Fire, without really knowing the meaning of those words or the impact it's having. And this is done in goodwill. This is done to improve projects, but also to get funding or win a contract. However, we have to tackle the heart of why data projects fail. There is a lot of great ideas out there, and that is wonderful. Lots of people have good ideas on how we can create value out of data. However, rather than just focusing on getting more and more new ideas, we should really be focusing on why projects fail and how to make these projects successful. One of the key reasons is the lack of understanding in the data itself. Now this happens for multiple reasons. Often when a contract is signed, the data might not have even been viewed or understood correctly. If this happens, what are the chances of having a successful project? Now, rather than just complaining, I'd like to show you an example of where I think we were able to successfully manage the data and what success that led to. This was a project I did quite a while ago now in cancer wait times. So the problem here is patients should be treated within 62 days of referral for treatment to cancer. Now I did this project a few years ago, but even now, as of 2022, there was a report that less than 3% of patients' cancer wait times, NHS trusts, have achieved that target. Despite this being a core component of the NHS long-term plan. Now, the project that I was involved in looked at the patient pathway of those patients that were treated within 62 days and compared it to patients that were not treated within 62 days. And we were able to find some really interesting insights, ones that you just wouldn't expect. I haven't shared the insights today just because of confidentiality, but what matters is the right-hand bit. The reason we were able to extract really interesting, unusual insights is because we integrated 11 different data sources. More importantly, from the business upwards, we were able to get the buy-in to be given the time to understand each data source, how to integrate it, and how to manage it so that it produced the patient pathway so that we can make the comparison. Only because of this investment did we get a holistic picture of the patient pathway and all aspects of patient care, including finance, pathology, prescriptions, radiology, that allowed us to understand these differences. So that's the first point, investing in understanding your data so that you're able to integrate it properly to understand the entire patient journey and the entire patient experience. Let's go into the second point. There is lots of blind spots in our data, and unless we adequately understand them in a data strategy, we're not going to be successful, frankly. I'm going to give you two examples of blind spots now. The first is a blind spot in the data quality itself. And literally just before this talk, I was just talking about this with some of the other speakers. This is a good example of one that came up a few years ago. So a doctor enters the blood pressure of a patient. He thinks it is 98 over 60. That then goes through something called the black box process. For this case, what a black box process is, it's a process that's poorly understood. It's a process that maybe in this example was developed 20 years ago by a guy who doesn't work at the NHS Trust anymore. And because that guy has left the NHS Trust, that process is still transforming the data that's input into the system, putting it into a database, but no one knows what transformations are happening. On the right here, you have the data analyst, and he's doing some analysis to try and get insights into the data. So he extracts the patient's blood pressure, and he reads it as 100 over 60, which is obviously incorrect. The real patient's blood pressure is 98 over 60. Now, this sort of error is bad enough for one patient. Now imagine what happens when it happens for hundreds or if not thousands of patients, or even on a national scale. And we're developing our insights based on this data. Having blind spots into data quality is really bad. And if we do not address this and have the realistic understanding of it, how else are we going to be successful and produce value from the data? I'd like to talk about a second area of blind spots as well, which is in the way the data is integrated. Now, I've talked about integration quite a lot of data, specifically because it is a very hot topic at the moment. Ranging from the federated data platform to integrated care systems, it's something that's high up on the agenda. However, we have a massive blind spot in the way we integrate data. At the top, you have some very well integrated data. There's a data set called HES, which is secondary care data, stands for hospital statistics. And for primary care data, we have something called CPRD, which is clinical practice research data link. However, a lot of the data in these data sets has originally originated for administrative purposes. We also have some semi-integrated data, such as genomics data, which is being invested in by the government and will eventually be well integrated. However, what I think the blind spot is the vast majority of clinical nodes in our systems is not integrated at all. The vast majority of data from electronic patient records isn't actually integrated because it's sort of semi-unstructured data, and the backends, the databases of electronic patient records, most of them aren't structured enough to allow the proper integration. How are we meant to develop the right data strategies if we have this blind spot in the level of integration of our data? These blind spots will prevent us from being successful if we're not honest about them and address them carefully. Now I'd like to talk about a second use case where we're aware of these blind spots, but at least we're handling them properly. As mentioned before, I'm working with CloudCube at the Medicine and Health Regulatory Agency currently. So for those that don't know, the MHRA for short is the drug regulator in the UK. They handle all licensing of drugs and make sure that all drugs are safe, essentially. You might have be more familiar with their USA equivalent, which is the FDA. Now, the NHRA approached us because they knew that their data was siloed. They knew that it wasn't well integrated, and they were dealing with the challenge of increasingly globalized system. What I mean by that is you might have a drug that was manufactured in one country, prescribed in another, but the side effect for that drug was experienced by a British citizen. Because of these challenges, we were stepped in to help them with their data strategy. Now, in order to do this, the first and most important thing was to build a comprehensive data strategy that understood all aspects of the system. We were led by the use cases, and that's always incredibly important because you want to understand your requirements for why you're building a data system or a data strategy to begin with. We understood how the technology and all the different business partners work together. Now this one's really important because this helps you build a comprehensive system that tackles the blind spot. A good example is we are currently talking to NHS Digital, the American regulator, the Food and Drug Administration, the FDA, the European regulator, the European Medical Agency, the WHO, World Health Organization, and the NIHR, the National Institute of Health Research, so that we build this comprehensive picture. Now this takes time. It is, a time-consuming process, but it is building a comprehensive picture. Additionally, we got key buy-in from important stakeholders early in important aspects of integration and interoperability, which means we understood which standards we were playing with very early on. And in this case, it was FHIR and IDMP standards. So that's point 2, understanding the blind spots. Now, point 3 is really important because another thing that I see is that sometimes we do spend time getting the right data together, but then no one accesses it. Accessing data, particularly healthcare data, shouldn't be as hard as it is currently. If we don't have the right people that are going to add value or get value from the data accessing it, then what is the point of putting the effort of putting it all together in the first place? I'd like to talk a story about a real friend of mine who's an orthopedic surgeon who's very interested in data science and wanted to do a research project to help his patients. He spent hours trying to access the data at his local NHS trust, and despite going to many different IT professionals to try and access the data, got nowhere. And by the time his rotation ended, he hadn't got access to the data and wasn't able to do the research. What an absolute waste. This is someone that genuinely wanted to help patients and couldn't because we don't have the right processes in place that allow people to access data. It sounds ridiculous when you think about it. We should be building systems and investing in systems that allow the right people to access the data so they can produce the value from the data. That is a sure start way to ensure an increased chance of success. Now, I am happy to see there is progress in this area. Trusted research environments is a hot topic at the moment in healthcare data, and rightfully it should be. It is helping improve access to people like doctors or academic researchers to the right data. However, honestly, trusted research environments are just the start. We need to be putting the right processes in place to make sure that the right people have access to the data, and we need to make sure that it's easy for them, that it's not difficult. We'll know this when people are not complaining that they're trying to do a project to help everyday citizens in this country and they can't. Don't know what happened there, sorry. Now, to summarize, the NHS data is one of the most valuable assets we have in this country. To give you an example of how valuable it is, the Financial Times wrote an article saying that healthcare data could form the basis of a UK sovereign wealth fund. It really is that fantastic. And it's fantastic because of the NHS. Very few countries in the world, if any actually, have a system similar to ours that allows us to get all this data. However, we have essentially 2 roads in front of us. We can invest in data correctly, which means we'll understand our data, it will be integrated, it will be complete, we'll have a holistic view of it without the blind spots, and the people that need access to it will be able to have access to it. Or there's the other path, which is we spend lots of money, billions, quite literally, on projects where we don't understand the data, we think we're going to produce a lot of value, and we don't produce any value. The reality is there is no alternative to a good, comprehensive data strategy that invests in our data. So thank you very much for your time, and if you want to discuss further afterwards, please do.